Hello everyone, welcome to the class. Today we are going to talk about the sleep cycle and the physiology of the sleep. So today we are going to talk about the sleep cycle, the physiology and psychobiology and dreaming in order to understand the science behind the sleep. So in this presentation we are going to do introduction about the sleep cycle, and then we talk about the sleep architecture and impact of sleep deprivation and different changes during the sleep, and also about the dreaming. So let's talk about the sleep. What is sleep? Sleep is a recurring state of mind and body, and it is characterized by altered consciousness, reduced sensory activity, inhibition of nearly all voluntary reflexes. All the voluntary reflexes, they are inhibited, they are minimized, and reduced interaction with surrounding. A person does not interact with surrounding. They cannot see, they cannot hear. They may be able to hear something, but they are not going to interpret and have um, uh, attention to the surrounding. Sleep is a crucial for physical and mental health, and it affects mood, cognition function, and all overall well-being. So sleep is very critical for every person, from newborn baby to old people, very old person, and lack of sleep will have a significant effect on body and mind. So we are going to talk about what are the effects, and if we um, don't have enough sleep, what will be the effect, and why the sleep is required in order to work properly. So as we already know, sleep cycle consists of two main types. One is called rapid eye movement, and other is called non-rapid eye movement. So the non-rapid eye movement sleep, NREM, and then followed by REM sleep, which is rapid eye movement sleep. The non-rapid eye movement sleep consists have three stages: stage 1, stage 2, and stage 3. Stage 1 is also known as N1 to N2 and N3, and typically the whole sleep cycle lasts 90 minutes and it repeats 4 to 6 times per night. So if a person sleeps less than that, so if you sleep for 4 hours or 6 hours, then you don't have enough time to have 4 to 6 cycles. So for an accurate sleep and have a best benefit of sleep, which we are going to talk about what the benefit of sleep, we should be able to sleep for at least um, 6 to 9 hours or 7 to 9 hours, which will give enough time to have repeated 4 to 6 cycles, which in each cycle is about 90 minutes. So in this presentation, I'm going to talk about sleep architecture. So what is sleep architecture? Sleep architecture is a terminology which refers to the structure and pattern of sleep cycles during the night. So all the sleep cycle, non-REM sleeps, N1, N2, N3, and REM sleep, how they cycle throughout the night, and how. So that's the architecture of sleep. It includes the progression through non-REM stages and REM sleep. Non-REM stages are stage 1, 2, 3, and then REM sleep, which changes in duration and intensity as sleep progresses over the night. So starting with the non-REM sleep, stage 1, which is also known as N1, is the lightest stage of sleep. So in this stage, we transition from wakefulness to sleep. So wakefulness is the stage W, uh, the first stage. So the transition from wakefulness to the first stage, which is a lighter sleep, is known as N1, and it is characterized by slow eye movement, reduced muscle activity, and drifting thoughts. This stage typically lasts for a few minutes, so about 3 to 5 minutes. So this is the shortest stage of the sleep, N1, and lasts about 3 to 5 minutes. Stage 2, which is also known as N2, is a deeper stage of sleep where movement stop and the brain wave slows down with occasional burst of rapid brain activity known as sleep spindles and K complexes. So when we are monitoring EEG, which is electroencephalography, the electrical activity of the brain, we can see the slowing of the EEG activity and a specific type of EEG waveform, which are known as sleep spindles and K complexes. So these sleep spindles and K complexes are seen only on stage 2 or N2 of sleep. So these N2 or stage 2 sleep account for about 50% of total sleep time. So if the sleep cycle is about 90 minutes, about 40 to 45 minute is stage 2 of sleep. The next stage of the sleep, N3, which is stage 3, is also known as slow wave sleep or SWS. So this slow wave sleep is the deepest stage of the non-REM sleep. It is characterized by delta waves, which are the slowest waves. So we have delta, theta, alpha, beta. We are going to discuss more on EEG section. So delta waves are the slowest wave, which are about 0.5 to 4 hertz. And that means 0.5 to 4 hertz 4 times per second. And they're the slowest and the highest amplitude brain waves. So these are the slow waves. So the slow waves are bigger amplitude. The faster waves are smaller amplitude, like beta activity, which is only seen in wakefulness. As soon as you close eyes, the beta wave disappears and we see alpha waves. And if you go to sleep, the alpha wave disappears, go to theta waves, and deeper sleep shows delta wave. So identification of delta wave during for recording EEG will confirm the stage 3 or deepest stage of the sleep. And 3 is also the most restorative sleep stage and is crucial for physical and mental recovery. So if you don't go while in sleeping, if you don't go to stage 3, which is the deepest stage of sleep, it affect the restorative process, because all the immunity and all the repairs of the epithelium or endotheliums and all the immunity is developed during this stage of sleep. So far we discussed stage 1, 2 and 3. Stage 1 is the shortest period, and then stage 2 is the uh, almost 50% of total sleep time, and stage 3, which is the deepest and restorative sleep. So those are non-rapid eye movement sleep. Uh, Once going deeper, we go to the REM sleep, which is rapid eye movement sleep, and the REM sleep is the stage where most dreaming occurs. The brain is highly active, resembling wakefulness. So if you're looking at EEG, it will look like the patient is awake, but the body experiences atonia. Atonia means all the muscles are paralyzed and there's no muscle activity and no muscle contraction except for respiration. It is a state of temporary paralysis. So all the muscles are paralyzed except for the diaphragm and the eye movement. And REM sleep is important for memory consolidation, learning, and emotional processing. So staying in REM sleep helps in memory consolidation, learning, and emotional processing. So if you are memorizing or working for your exam or trying to understand something, going into deeper stage of sleep helps in consolidation of your memory. Otherwise, you will not be able to remember or retain all the information you learn in all day. So in adults, the sleep cycle starts with stage 1 and 1. It progresses to stage 2 and then stage 3 and final to REM sleep. This cycle repeats throughout the night with the proportion of REM sleep increasing in later cycles. So in first cycle, the REM sleep is the uh, shortest, and then the second, third, and fourth cycle, the proportion of the REM sleep increases in time over the night. So sleep cycle also changes over the lifespan. So during from newborn to adult, the sleep cycle have there's a progression or the changes in the cycle. The newborns spend more time in REM sleep, while older adults experience shorter and more fragmented sleep cycles. So this, uh, so the newborns have a longer and more REM sleep in proportion to their total sleep time, and as we go older, and so the adults have shorter REM sleep as compared to the newborn, and they have more fragmented sleep cycles, and they have less deep sleep and 3 stage of the sleep. So the role of circadian rhythms. So circadian rhythms are 24-hour cycles and physiological processes. These rhythms, circadian rhythm is also known as sleep cycle, is or inner sleep cycle, is influenced by external cues like light and temperature. So if you have more light and more bright light, the sleep cycle is affected, and if the temperature of the room or where are you trying to sleep is not comfortable, it also affects your circadian rhythm. They also regulate the wake sleep cycle, hormonal release, and other bodily function during the sleep. So let's talk about the brain structure which are involved in the sleep. The key brain structure which are involved in sleep includes number one, hypothalamus. Hypothalamus is responsible for regulating the circadian rhythm. Then the pineal gland. The pineal gland secretes melatonin, which is also affecting your sleep, and the brainstem. The brainstem controls transition between wakefulness and sleep. So hypothalamus, pineal gland, and brainstem are the three key structure which affect the sleep cycle, and by affecting circadian rhythm, secreting melatonin, and controlling the transition between wakefulness and the sleep. So if you look at this is the diagram where we can see the autonomic nervous system, and in the autonomic nervous system we have central nervous system and autonomic nervous system. Autonomic nervous system is not a um, it's automatic, so we don't have a control on that. And though there are two main part of autonomic nervous system, one is called sympathetic nervous system, and the other one is known as parasympathetic nervous system. So the sympathetic nervous system is known as fear and fight, or flight or fright, and parasympathetic system help in rest or digest. So those systems, they affect different part of the different organs in the body. And then we have sympathetic chains, which are all the nerves which are combined and they form the ganglia, and that most sympathetic chains are present in the cervical region, uh, and uh, and all these and those affecting your lacrimal gland, the eye movement, the lacrimal ciliary ganglions and salivary glands, and heart rate, lungs, liver, pancreas, stomachs, glands, intestine, ball and bladder. So all the body internal organs, they are controlled by sympathetic and parasympathetic nervous system. So different neurotransmitters which are released and affect our sleep um, they play a crucial role in sleep regulation. One is GABA, gamma-aminobutyric acid, which promotes sleep by inhibiting wakefulness and promoting regions. So GABA promotes sleep by inhibiting the wakefulness promoting regions. So when the regions of the brain which promote a wake state, they are inhibited, so the person can go to sleep. The neurotransmitter also play a crucial role in sleep regulation by controlling the serotonin, which helps regulate sleep onset, and acetylcholine is involved in REM sleep. Those are the three. So the hormonal changes during the sleep, the hormone fluctuate during sleep. Melatonin rises in the evening and promoting sleep. So and the melatonin is released during the evening, and due to release of this melatonin, it helps in sleep. So when our body is adjusted to a time in certain region, and if you are flying or you have a jet lag, and that jet lag affect the melatonin rhythm, because the body is adopted to secrete melatonin in the evening, 7 p.m., 8 p.m., about, for example, central time. But now you move to Australia or go to Middle East or any other country, and then at that time the evening is morning, and then you feel, that's why we feel sleepy, and we have more, because the body is not looking at the temperature or the time outside. It is used to, the melatonin is secreted at that time, and you feel sleepy at night, and then it takes some time to get used to that. The cortisol also peaks in the early morning, and that release of cortisol helps in to wake up. So the increase in cortisol level, if you measure the cortisol, it helps to wake up in the morning. Growth hormone is also released during deep sleep, and it adds in tissue repairs and the growth. So if there's a lack of sleep, there's be lack of growth hormone release, and lack of growth hormone will affect the tissue repair, and the person will be more prone to disease and decrease in growth. So the growth will be retarded or affected in this person. So endocrine system, which secretes cortisol, uh, is under the circadian control. It peaks at 8 a.m. It is lowest at 12 p.m. to 4 a.m. 12 midnight to 4 a.m. The clinical relation, for example, Cushing syndrome, chronic primary insomnia, and sleep deprivation, they can cause increased cortisol release as well. These are the two graphs which shows the plasma level of growth hormone on y-axis to the time, like 18, which 6 p.m., 22 is 10 p.m., 2 is 2 o'clock in the morning, 6 o'clock, 10 a.m., 4. So you can see from 2 p.m. From 10 p.m. to 2 a.m. there's a big peak in growth hormone from almost 0 microgram per liter to 17, 18 microgram peaking at midnight, and then it decreases around after 2 a.m. and the slight increase at 6 a.m. then the decrease, and then another increase surge at about 11 a.m. till 2 p.m. So those are the level of plasma growth hormone, they affect their increase. So that's why the growth hormone is released at the night time while in sleep, and that helps in growth of a person and also help in immunity. The lower bar diagram in red is plasma cortisol level in microgram per deciliter. If you can see from 0 to 20 microgram per deciliter on y-axis, and then time of the day and the x-axis. So 6 p.m. And so you can see around midnight the plasma cortisol level as the lowest level, but around 5 a.m. it rises with a peak around 6 a.m. and then it decreases over the day until night. So highest at early morning and then again next early morning. So insulin level are also affected by the sleep, and or sleep affect the insulin level. So we have more in sleep with non-rapid eye movement than REM sleep. So insulin level are higher when the person is in non-rapid eye movement sleep, stage 1 to 3, as compared to REM sleep. If a person has sleep deprivation, that will lead to insulin resistance. A person with obstructive sleep apnea will have insulin resistance and may result in diabetes mellitus stage 2, and which will be irrespective of the person or patient BMI. Testosterone level are also higher in REM sleep as compared to non-REM sleep. The sleep deprivation also result in decreased testosterone level. Obstructive sleep apnea (OSA) also result in decreased testosterone level, and if we're doing positive air pressure or PAP, it improves the testosterone level. PCO is also increased in testosterone, and it increased in obstructive sleep apnea. So here in the diagram we can see gastrointestinal tract. The glucose is absorbed and glucose is processed in liver and adipose tissue, and then the pancreas secrete insulin, and that insulin affect the target tissue. So hypothalamus secretes gonadotropin releasing hormone GnRH, which affect the pituitary gland, and in response to that gonadotropin releasing hormone, pituitary gland release follicle stimulation hormone in female and luteinizing hormone LH, both hormone, and those hormone effect on testicles, and they help in testosterone. This is another diagram where we can see the level of serum testosterone compared to the clock time. So the testosterone level is highest around 6 a.m. and then it drops at the other time. Thyroid versus prolactin. So the top image, which is plasma thyroid stimulating hormone. So thyroid stimulating hormone is secreted by the glands, and it affects on thyroid. to release T3 and T4 hormones. And on y-axis we can see micro unit per milliliter, and so they are highest at the midnight level during the sleep. And also plasma prolactin level, which is also higher at the morning time and also at the 10 p.m. and from 10 a.m. to 6 p.m. Now, let's talk about the cardiovascular changes that can occur during the sleep. So, heart rate and blood pressure decrease during non-rapid sleep. So, when we are in stage 1, 2, 3, the heart rate drops, the blood pressure drops, allowing the cardiovascular system to reset. However, during the REM sleep, these can fluctuate with spikes in heart rate and blood pressure. So, the REM sleep, there could be a spike in the heart rate, so you can see more faster heart rate, an increase in blood pressure as compared to stage 1, stage 2, or stage 3 of the sleep. So, so here we can see the effect of sleep on cardiovascular disease. So if somebody has a poor sleep quality due to insufficient sleep duration or excessive sleep duration, it will affect the it causes systematic inflammation, it will cause sympathetic tone, and cause cell injury. And all these phenomena will affect the heart, and it is in coronary events. It will result in high blood pressure, hypertension. It will result in arrhythmia, which is abnormal heart rate, and it also affects in metabolic syndrome. If the person has obstructive sleep apnea, where the quality of sleep is not good, it will result in intrathoracic pressure changes, reactive oxygen species, systematic inflammation, and sympathetic tone. And that will result in also in hypertension, arrhythmia, heart failure, coronary artery disease, and metabolic syndrome. So a poor quality of the sleep can have effect on mental health. It can have result in obesity. It can affect your cardiovascular health, and it's also cause health disparities. So, so that was what. So we have hormonal effect, we have cardiovascular effect, and now we talk about respiratory changes during the sleep. So breathing becomes slower and more regular during non-REM sleep, stage 1, 2, 3, while during REM sleep, breathing can become more irregular and shallow, sometimes with pauses known as REM-related apnea. So in first three stages of sleep, the breathing is more slower or more regular as compared to REM sleep, where the breathing is more irregular and more shallow. And sometimes we see pauses which look like apnea, and it called REM-related apnea. So these are some images where we are comparing the non-REM sleep transition to non-REM to REM and then to REM sleep. So non-REM sleep during the stage 1 to 3, we have more parasympathetic activity, decrease in heart rate and blood pressure, respiratory sinus arrhythmia, and decrease in muscular activity. So, and when it transitions to non-REM to REM sleep, pulses of vagal activity, heart breaks, and even asystole can occur. So asystole means there's no heart rate, so the heart stop pumping, or you don't see the heartbeat. And autonomic activity changes in posture, and it increases in blood pressure and heart rate. And when the person go to REM sleep, it may result in muscle atonia, which is no tone or no muscle, it's total paralyzed. Pulses of sympathetic activity, which results in increased heart rate, increase in blood pressure, and muscle spasm. There will be episode of tachycardia and cardiac pause, irregular breathing, and period of desaturation and intense brain activity. And these images we see that there are two channels of EMG and two channels of EEG recording. Um, so here, these are the recordings, data from the patient. And EOG stands for electrooculogram. Electrooculogram is the recording of the eye movement. So we can place electrode above the eye and below the eye, 4 electrodes, specific location. And when there's a movement in the eye, These electrodes record the movement of the eye, and we can tell the eye is moving up, down, left or right, and which cranial nerves is activated or which muscle is activated. Is it superior rectus, inferior rectus, medial rectus, lateral rectus, or inferior oblique or superior oblique? So RC is the respiratory function, and abdominal ABD is the abdominal. So the movement of, so those are the, we have um, sensors on the chest and the abdomen, so they record the movement of the abdominal wall and the chest wall during the sleep. And again, uh, at the bottom we have the same recording from a different patient. So body temperature, so during the sleep, body temperature regulation also happens. So maintaining a comfortable temperature throughout the night doesn't just help you to avoid waking up in the puddle of the sweat. So if the temperature is good in the sleep, so you don't wake up in the middle of night and you're sweating, and because if it's too hot or too cold, that will cause discomfort and you'll keep waking up in the midnight, and that will cause disruption in your sleep cycle. Your body temperature is also an important component of your circadian rhythm. This natural clock, circadian rhythm, is the natural clock we talk about, which control the sleep cycle. And this natural clock determines your energy highs and lows throughout the day. This include when it's time to sleep and when it's time to wake up. And during the sleep, different hormones are secreted, and during the wakeful time, other hormones are secreted, or they increase. The blood serum level is increased, and they have more effect of those hormones during the sleep or awake time. After waking up, your hypothalamus, which is a very small part of the brain, is small for regulating body temperature, hunger, releasing hormones, and other vital functions get to work during, and it drives your body temperature from its baseline 98.6 degree, and it can go up to 100.4 degree. This gradual rise occurs during morning through late afternoon. So when you wake up, so there's this body increase in body temperature, which is normal resting body temperature is 98.6 degree Fahrenheit, which is equal to 32 degrees Celsius. But in the morning, it increases to 100.4 degree, and that helps in waking up. And then during uh, during the day, it starts going down, and body temperature drops during sleep, and it reaching its lowest point in early morning. This drop is controlled by circadian rhythm, and it also helps facilitate sleep onset and maintaining the sleep throughout the night. So we can see the body temperature during the day, so 3 a.m. and then so we can see at around 1 a.m. and it decreasing uh, during the sleep, and it's the lowest point at 6 a.m. and then at 6 a.m. start getting up, and at highest point at 6 p.m. So thermoregulation, the temperature regulation, preoptic and anterior hypothalamus. Preoptic and anterior hypothalamus controls the core body temperature. The lowest temperature is about 4 to 6 a.m. and maximum temperature is about 6 to 8 p.m. At night, preoptic and anterior hypothalamus warms up and decreases ARS activation, which result in decreased sleep onset latency. Sleep onset latency is the time it takes for you to go to sleep. So, so if anything that can help in sleep, the sleep onset latency is decreased. When you lie down in the bed, how much time will it take to sleep? And also it increases the third stage, which is the deepest stage of sleep. It also cools down to sleep sound and heat up to wake up. So cooling down, decreasing temperature helps in sleep, and warming up or increased temperature helps to wake up. The primary insomnia and delayed sleep phase result in delayed temperature as maximum. So for the endocrine system, thyroid stimulating hormone lowered by sleep. There's decreased thyroid hormone level at night and increased thyroid, and that will result in increased thyroid stimulating hormone, because when your thyroid hormone is decreased, your thyroid stimulating hormone will be increased to stimulate the thyroid gland to secrete more thyroid hormone. The TSH, thyroid stimulating hormone, and prolactin, sleep dependent versus circadian dependent, and so the effect of sleep work versus the effect of the sleep cycle circadian rhythm. The clinical correlation, hyperthyroidism may result in insomnia, and hypothyroidism may result in obstructive sleep apnea, and obstructive sleep apnea result in more increase in thyroid stimulating hormone. So the musculoskeletal system during the sleep, the muscle tone, wakefulness has the highest muscle tone, followed by 3 stages of sleep, and the REM sleep has the lowest muscle tone or atonia. Non-REM sleep, stage 1 to 3 is hypotonia because we are sleeping, so it's not the muscles are not as active as during wakefulness, but it's not atonia, which is total lack of muscle tone. Atonia occurs only in REM sleep. So in non-REM sleep is a hypotonia. Inhibition of deep tendon reflexes. So deep tendon reflexes are also affected during sleep. If you look at the pupillary system in the eyes, uh, there's a constriction in non-REM sleep and tonic REM sleep, and dilatation during phase of REM sleep. Immune system. So immune system is has also affected by sleep. The sleep enhances immune function. So if you have a good night's sleep and you sleep appropriately enough time, that helps in good immunity. So during deep sleep, the immune system releases cytokines, which helps the body fight off infection and inflammation. And these cytokines help in highlight and sleep role in immune defense system. So if there's a lack of sleep, the cytokines are not released, and body will have negative effect and will not be able to have a good immune function. So um, acute sleep deprivator will have adaptive immunity and decrease in lymphocyte. There will be decrease in adaptive immunity. There will be decrease in lymphocyte. There will be vaccine antibody response. And chronic sleep deprivation, a person who has a chronic sleep deprivation versus acute sleep deprivation is just if you don't sleep for 1 day or 2 days, and chronic you have for a very long time. It will um, affect your immunity. It will affect your inflammation, and also different hormones which are responsible for immunity. It also increases leukocyte trafficking. Infection and inflammatory conditions such as will result in increased sleep pressure, sleepiness, and increase in non-REM sleep, slow wave activity, and they also decrease the REM sleep. So immune system pro-inflammatory cytokines release in pro-sleep, and anti-inflammatory cytokines result in anti-sleep. So if they have pro-inflammatory cytokines, they promote sleep, and if you have anti-inflammatory cytokines, they will inhibit your sleep. The lymphatic system is more active during sleep and clearing out waste product, which is so this lymphatic system helps in clearing of waste product from the brain, including beta amyloid, which is with the so the accumulation of beta amyloid in the brain has been suggested for association with Alzheimer's disease, and this cleaning process is crucial for the brain health. So lymphatic system in the whole body is a system which clear all the waste on all the secretions which are secreted or released from the blood into the body system, and including the brain, spinal cord, the muscles, and everywhere. And if the person has more of these beta amyloid in the brain, that can result in Alzheimer's disease over the years. So there's a new study done recently, so published that there's a gap between neurons synapses in the brain. So and those synapses they are in they are increased during the sleep. So by having more gap in the synapses during the sleep, uh, all these secreted material over the day, they are reabsorbed and they're excreted from the body. But if they are not, if the person doesn't go to sleep, that synapses don't increase in size and they don't reabsorb these beta amyloids, and that will result in Alzheimer's disease or dementia and other disorders. So metabolism, basic metabolic rate is highest, BMR is highest during the week, as then REM sleep has the lower and non-REM sleep has the lowest, or almost sometimes equal to the REM sleep. For the dreaming, the REM sleep have more complex and irrational dreaming, and 80%, and non-REM sleep have more straightforward and realistic dreaming. So when we are dreaming, so we can dream in stage 3 of REM sleep, or REM sleep, or stage 3 of non-REM sleep. But the difference between those two dreams will be the sleep in non-REM sleep, or stage 3, will be more straightforward or more realistic, which is about 20% of the time. And REM sleep will have more complex and more irrational dreaming, which occurs about 80% of the time. So that was about sleep, but let's talk about the sleep deprivation when there's a leak of when we don't sleep enough. So sleep deprivation can disrupt metabolic processes, increase the risk of cardiovascular disease. So lack of sleep will result in disruption of metabolic process in our body. It will cause increased risk of cardiovascular diseases. It can impair the cognitive function of a person. It also weakens the immune system, and it emphasizing the importance of adequate sleep. So um, all these factors of sleep deprivation emphasizes the importance of adequate sleep every day. So these are the images which will again typical daily rhythm of sleep cycle. So you have sleep urge, and then uh, in the afternoon sometime, and then you go decrease in the earth, and then the sleep at night. There's a urge of sleep, and then sleep is needed, and if the person can sleep, and those cycles happens. So the alertness, how our circadian rhythm affect our level of alertness. So this is the attention from 0 to 10. 0 is sleeping and 10 is 100% concentration. So the concentration is lowest around midnight until 6 a.m. and then it gets better and highest at about 10 o'clock, and then it drops the attention until 6 p.m. and then it increases until 8 p.m. and then it drops until midnight. So attention is the highest in the daytime, especially early morning and mid-afternoon, and then later in the evening. So this is a paper study published and talk about the accident and casualties, the risk of in percentage according to as in relation to the time. So the highest risk, so you can see the accident in the white box, injuries in the gray and black, and fatalities. So highest injuries and highest fatality occurs at 5 o'clock, 6 o'clock, and 7 o'clock in the morning, and that is because a person will have a lack of sleep, and that will result, if you are waking up very early and you don't sleep early in the night, you're sleeping late and waking up early. So this is the data from uh, the published data of the all the accident happens, and it was plotted that what is the best what is the time that where the accident happened most. So this was the graph um, of the highest time of the accident was early morning from 5 to 7 a.m. Another data which was published, overlay of vehicle accident data, performance errors and circadian rhythm. So car accidents in the red, meter reading errors in dark red, and circadian rhythm in yellow. So you can see circadian rhythm, midnight has the highest which is the deepest sleep, and then 6 a.m. the lowest, and then after in the afternoon there's an urge of the sleep, not as big. So the car accident are highest after midnight and early morning. So the vehicle accident, the most common cause are high speed single vehicle accident, highest accident at 2 to 4 a.m. and 2 to 4 p.m. Off-road accidents, mostly young men, and most people have less than 5 hours sleep, and they've increased, they're driving for a very long duration. Uh, so these are two graphs which compare the effect of sleep duration versus alcohol impairment. Mean relative performance on the x-axis and hours of wakefulness. So we can see on the blue one, so the performance when you're awake for 10 hours, your performance is the highest as compared to 26 hours. So continuous, uh, so uh, waking for a very long time, it decreases your performance. It gets less and less. On the right side, this, uh, this paper was published by Drew Dawson and Catherine Reed in uh, 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 and, and on the right side, this is a diagram. So alcohol impairment, so blood concentration of the alcohol when increases, it also decreases the mean relative performance of a person. So this paper published by Howard, um, and it's discussed the accident risk related to subjective sleepiness for commercial drivers. Uh, and another, the level of melatonin, which is in control versus patient with traumatic brain injury. So the level of melatonin is lower in patients who have traumatic brain injury because the brain is the one which is secreting melatonin. So brain, it affects the TBI, affects the release of, and that in the result that will affect the concentration and sleep habits of a person. So this is data from US military and Army, Navy, Air Force, and Marine, and so medical errors. So survey, more than 60% anesthesiologists report making fatigue as surveys done of anesthesiologists, and more than 60% report making fatigue related errors. This was published by Graveston. 30% anesthesia incidents were reported by Morris in 2000. 5% were preventable accident. 10% drug errors by Williamson, published in 93. Post-op surgical cremation rate was 45% higher if resident was post-call. So more, uh, so all the different type of errors, we're talking about different type of accidents, which are all, most of them are preventable accident or drug-related accidents, errors which can affect in negative outcome of a patient. They are higher with the sleep deprivation. So longer the residence on the job, more they have sleep deprivation, they have more chances of doing an error. So this is a study by Park in 2000 and Steele in 99 about the resident safety. So 50% of increased risk of blood-borne pathogen exposure incident, needle sticks, laceration, etc. in resident between 10 p.m. and 6 a.m. So all the residents which are working, so that risk is increased more than 50%. Uh, needle stick and laceration and cuts during 10 p.m. and 6 p.m. 58% of emergency medicine residents reported near crash accident while driving back home, uh, which is very high, 58%, and 80% post night shift. 80% of those residents were post night shift, and increase with the number of night shift per month. So more night shift they have per month, more accident they will have. So this was a medical survey of medical trainee about driving. Interns had 2.3 uh, more risk of crashes if they were reported working for more than 24-hour shift. Each extended shift per month increased the risk by 9.1%. The interns reported working more than 5 extended shifts had increased of falling asleep while driving, increased risk of falling asleep while stopped in traffic, and increases risk after extended versus non-extended shift for crashes and for near misses. So in summary, so when these interns or residents they're working for a longer time and they have longer shift, they are more prone to having accident due to while driving is while falling asleep during driving, or falling asleep during a stop traffic site, or they have a crash, or they have near miss crash. Postgraduate resident year 1 and 2. So these are the hours of sleep and the percentage of risk of reporting accident. So less than 4 hours have highest, then 5 to 6 have little bit less, and more than 7 hours have the least reported incidents. Um, so the American Academy, they have these regulations and they were revised in 2011 for supervision. The 2003 appropriate supervision of residents and patient care activities was required, and in 2011 PGI first year residents should be supervised either directly or indirectly with direct supervision immediately available. Hours per week in 2018 it was the maximum hour allowed was 80 hours, an average over 4 weeks, and in 2011 it's still 80 hours, which is average over 4 weeks. Days off, for the old 1 7 days, average over 7 days, and now so 2011 1 day every week with average over 4 weeks. Maximum duty period in 2003 was 24 hours plus 6 hours to transfer a care, and it was revised in 2000, and maximum duty period was limited to 16 hours straight. So part 2 is dreaming. So we are going to discuss a little bit about dreaming. So dreaming is a complex mental experience during sleep, often occurring during REM sleep. Dreams can involve vivid imagery, emotions, and narrative, and reflecting the brain's activity during sleep. So dream can happen, and it can be a different type of dreams. There are different theories of dreaming. And why we dream. Freud suggested dreams are windows to our unconsciousness, or dreams to our unconscious desires, while activation synthesis model proposes that dreams are the brain's attempt to make sense of random neural activity during sleep. Dreams are generated by the brain's limbic system, particularly the amygdala and hippocampus, which are involved in emotions and memory. The prefrontal cortex is responsible for um, logic, and decision making is less active, which explains why dreams can be illogical and bizarre. So during the dreaming, the prefrontal cortex is less active, it's suppressed. So, and this prefrontal cortex, PFC, is responsible for our logic and decision making function. And due to this lack of logic and decision making function, then we see the dreams, and those dreams are more illogical or more bizarre. So REM sleep is strongly associated with dreaming, rapid eye movement. During REM sleep, brain activity is like wakefulness, but the body is paralyzed. So the brain is more awake state, but the whole body is weak, is paralyzed in atonia, preventing us from acting out our dreams. So whatever we are dreaming, we don't move or we don't do that. REM dreams are often more vivid and emotional as compared to non-REM dreaming in stage 3. So REM sleep is a more vivid and more emotional. Dreams can also occur during non-REM sleep, particularly in stage 2 and stage 3. So the stage 2, 3, these dreams tend to be less vivid. They are less vivid and more thought-like or more abstract-like. They reflect the brain's slower activity in these stages of the sleep of 2 and 3. So the brain activity during dreaming, if you're doing the recording, EEG recording, brain activity recording during the person is sleeping, it will show that the brain electric activity during dreaming is like wakefulness. That means wakefulness, you have higher activity, which is mostly beta activity. Beta activity is from 13 hertz to 30 hertz of frequency. The waveform are moving at the rate of 13 to 30 times per second, which is the fastest activity in the wake, and that is seen especially in the REM sleep. Uh, and imaginary imaging studies also shows increased activity of amygdala or hippocampus and visual cortex during dreaming. So if you're doing MRI or functional MRI, especially functional MRI, we can see those more activity in amygdala, hippocampus, and visual cortex during the dream. So lucid dreaming occurs when the dreamer becomes aware they are dreaming and can sometimes control the dream's content. So if you're aware, if you're dreaming and and then you're aware that you're dreaming, and then you can control what's happening dreaming or getting out of the dream, that will be lucid dreaming. This phenomenon is associated with increased activity in the prefrontal cortex, which is responsible for logical and decision-making skill, the brain region involved in self-awareness. So when this prefrontal cortex is more active, then you will have more control on your dream. So the emotional regulation during dreams may help process and regulate emotions. The amygdala, which is active during REM sleep, plays a key role in processing emotions, suggesting that dreaming might help us manage and integrate emotional experiences. The dreams are thought to play a role in memory consolidation, particularly during REM sleep. This process helps strengthen and integrate memories, contributing to learning and long-term memory formation. So if you're learning something, you're reading something, and you're trying to memorize something, having a good sleep is very critical. And because going to REM sleep or stage 3 sleep or non-REM sleep, where that will help in memory consolidation. And if you have apnea, somebody has apnea or sleep apnea, or other is central apnea or obstructive sleep apnea, person can keep waking up again and again in the night, and they don't have complete sleep cycle, and that will have in their affect different function, and they will also have their memory affecting their memory consolidation of their memory. Dream can influence our mood, creativity, and problem solving ability. For instance, dreams have inspired creative works and scientific discoveries, and they can also help us work through emotional or psychological challenges. The different cultures have various interpretation of dreams. Some view them message from divine, while others see them as a reflection of subconscious mind. Dreams have been important in rituals, prophecy, and art throughout the history. So the emerging areas in dream research include the use of neuroimaging to better understand the brain activity during dreams and the potential for controlling the enhancing dreams for therapeutic purpose. So neuroimaging, which include MRI and functional MRI and other imaging technique, that helps in better understanding of the brain activity while the person is dreaming, and the potential for controlling or enhancing dreams for therapeutic person of these patients. So sleep quality directly impact dreams frequency and recall. The poor sleep can lead to more vivid or disturbing dreams, while good sleep quality can result in more positive and memorable dreams. There's a strong connection between sleep, dreams, and mental health. So as we discussed, having a good sleep, uh, and if you're not waking up, you don't have an apnea, and you have all the situation, temperature, and all the sleep hygiene correct, then you'll have a good sleep, and then you'll have dreams, and those dreams will have in good mental health. Disorder like depression and anxiety can alter sleep patterns and dreaming, and vice versa. So our depression can also affect dreams, uh, sleep patterns, and sleep disturbance and sleep pattern can also affect can cause in depression, suggesting that dream content might reflect or influence mental health of a person. Advances in technology like polysomnography, which is sleep study, and functional MRI have improved our understanding of sleep and sleep dreams. So if we can do, we typically do PSG, which is polysomnography, and sleep study, and the person goes to this suite where they sleep for at least 8 hours, 5 to 8 hours, and different type of recordings are done. For example, EEG, we do EEG and EMG, chest movement, abdominal movement, chin muscle movement, leg muscle movement, and snoring, and all these recordings are done, and we have better understanding of the person, how the person's sleep was at that night. Researchers can now monitor brain activity and also body functions during sleep in very significant detail, which was not done in the past. So in summary, sleep involves significant physiological changes such as alteration in brain activity, hormone levels, cardiovascular function, and immune system activity. All of these are crucial for maintaining overall health of a person. Dreaming is a complex psychobiological process which is influenced by brain activity, emotions, and memory. Dreams can serve multiple potential functions, including emotional regulation, memory consolidation, and creative problem solving for us. Also, the understanding the science of sleep and dreams has important implications for improving health and well-being of a person. By optimizing sleep quality, we can enhance the cognitive function and balance and or health balance and overall physical health of a person. So the sleep cycle again, we have stage 1, stage 2, stage 3, and stage 4. Stage 4 is the REM sleep. In the past, there were 4 stages of, if you look at old papers or old images, you'll see their non-REM sleep have 4 stages, 1, 2, 3, 4, and then have REM sleep. But now the new criteria, the stage 2 and 3 and the stage 3 and stage 4 are combined. So now we have only 3 stages of non-REM sleep and 1 stage of REM sleep. So stage 1 is light transitional sleep, which is drowsiness and sleep, deep sleep, which is the start of drowsiness and start of deep sleep, and it lasts for a few minutes. And then we have stage 2, which is more stable sleep. Chemical release, the person is difficult to wake up, all these chemicals release, and it is almost 50% of the total sleep cycle. And then deep sleep is stage 3, where growth hormone is released and all the immune system is developed and body restoration and memory consolidation is done. And then we have REM sleep, rapid eye movement, with this muscle atonia and the eye movement and dreaming. And REM sleep, memory revitalize the memory, and intense dreams occur, more vivid dreams occur in this cycle. The whole cycle is about 90 minutes to 120 minutes, and it occurs about 4 to 5 times. So stage 1 is the lightest, 1 to 7 minutes. The heartbeat slows down, breathing slows down, eye movement slows down, muscle relaxes, and might occasionally twitch. Brain waves begins to slow down from beta to alpha and theta. And stage 2 is 10 to 25 minute duration. The heartbeat and breathing slows down even more, muscle relax even more, body temperature drops further, eye movement stops, and brain wave activity slows down. So stage 2, we see sleep swindle and K complex. Stage 3 is the deep sleep, which lasts for 20 to 40 minutes, and we see delta activity, the slowest EEG activity, the heartbeat and breathing slows to the lowest level, and they will reach to during the sleep, and the muscle stays relaxed, hypotonia, and brain wave slows down even more to delta waveform, which is 0.5 half to 4 hertz. Stage 4, which is REM sleep, lasts about 20 to 40 minutes. Behind your eyelid, your eyes move rapidly from eye side to side. Breathing speeds up, your heart rate increases, your breathing increases, and breathing becomes irregular. Heart rate will increase, the blood pressure will increase in this stage 4. So for the dreaming, light dreaming and stage 1 and stage 2 is little bit light dreaming, light sleep, and there's no dreaming in that. Stage 3 is deep sleep, where the dream occurs and vivid dreams occur in REM sleep. Thank you everyone, and I'll see you in next class.